anytime, any day. And we say this is stronger. Why? Because we've got the bragging rights. And guess who gave us the bragging rights? You did give it to us. So we appreciate you. And you deserve this. Right, this is the political and current affairs program show. We call it Eagles Outlook. And in the midst of all of the happenings that's been going on, keep in mind one of the recent, our assets, outside the shores of Nigeria, where the presidency or the Nigerian government has said it has commenced both diplomatic and legal steps to recover the three presidential aircraft seized in France on account of indebtedness. Well, the diplomatic and legal means are being currently explored by the Office of the National Security Advisor, that's the NSA, and the Office of the Attorney General of the Federation, AGF, and Minister of Justice, right? And the presidency, in fact, had spoken about that. They've spoken on the fact that this Chinese company Zhashang Fasheng is trying as much as it could to seize national assets, and Nigeria is not pleased about that. However, the government is working assiduously to ensuring that things, got better and it puts things in the right perspective. We've also seen issues that border on the fact that the president had made very strong remarks just yesterday, asking African leaders to make more strategic and deliberate efforts in addressing the exodus of skills and talents from Africa. In fact, these efforts, he said, include stemming tribalism, rewarding performance, and reforming archaic judicial systems. It is on this bedrock that we'll be looking at the topical issue for today, which borders on the health sector, Nigeria's health sector challenges and its expectations. It is no news the fact that Nigeria's health care sector is facing or has faced significant challenges, including a brain drain of skilled healthcare professionals and inadequate access to affordable healthcare services. Now, the National Health Insurance Scheme, or the National Health Insurance Act, and the National Policy on Health Workforce Migration aim to address these challenges. However, though, their implementation has been slow, and many Nigerians remain somewhat skeptical about their effectiveness. Well, we'll be looking at, two basic, stories that border around the topical issue of Nigeria's health sector, talking about the challenges and the expectations. We're looking into that. Might I give you, just a broad look, an outlook into what, these stories would be. Recall that there has been matters that bordered around the National Health Insurance Act, where the National Health Insurance Act was signed into law 2 years ago, and this was to ensure affordable healthcare services for all Nigerians. And you must also recall that there's been low enrollment. Right. And we saw that, of course, on the front page of Nigerian dailies. And the key stakeholders, including the government and health sector, by encouraging Nigerian healthcare professionals abroad to return. The policy also is facing challenges, including poor working conditions, inadequate fundings, and limited awareness. And then stakeholders, including the government and healthcare professionals, they've expressed their concerns and expectations, right? Well, that being said, we should also let you in on the fact that it was on the front page of Nigerian newspapers, the fact that about 1,400 healthcare professionals. There's also the policy that is trying to see to a restraining somewhat or constraining of health professionals from just arbitrarily leaving the country and going outside the shores of Nigeria. But to talk with me, to talk with us, to speak with us on this issues would be none other but our guest, who's in the person of Dr. Ubong Essien. He's going to be joining that conversation right here via, the Google. So you might as well want to go across social media platforms right there and see to it that you also get wind of not just the audio aspect, but the audio-visual rendition of this particular program show for today. Well, good morning to you, Doctor.
Good morning.
Yes.
Good morning. Udrak, how are
Yes,
you?
I'm fine. Thank you, doctor. Very well. Thank you. I don't know. I'm having this feedback. I don't know if it's from my ends or your ends. I can't say. Okay. Are you there? Hello? Okay, so we would see how we would, we could join in again and have you join up. But then, yes, the conversation surrounding this topical issue also borders around some concerns, and these concerns would be concerns the Nigerians have, right? Nigerians are having some strong concerns about, the topical issue. I mean, we're looking at two angles to it. First of all, the National Health Insurance Act is one on the one side, where the National Health Insurance Act was signed into law 2 years ago to ensure affordable healthcare services for. But it does seem as though this particular scheme has not been very popular, as we still have Nigerians paying out of pockets up until today, right? And quite a number of persons have blamed it on the states, saying that the states have not made it very bold in it, because one of the challenges has been low enrollment rate, non-compliance, limited awareness, and inadequate funding, hindering its implementation, right? And then, of course, we'll be talking about or looking at the national policy on health workforce migration. It is no news anymore, the fact that Nigeria is trying its best to ensure that some of our professionals, especially within the health sector, are, spread across the country. Would be, I wouldn't want to use the word lured, but would be convinced to want to come back home, because we're experiencing a brain drain situation as it stands. You would agree with me. And the policy also is looking at is facing some challenges, though: the poor working conditions, the inadequate fundings too as well, and limited awareness. And stakeholders, including the government, and healthcare professionals, have expressed concerns and expectations. Now, you are a former vice president, Association of Resident Doctors, National Hospital Branch, right? It means that you have been, you're one in terms of your portfolio. Would have some understanding to some of these issues. Let's start with the first story, right? Which happens to be the National or the National Health Insurance Act. What would be your comments on this? What would be your take on this in terms of implementation? Are you there, Doctor? Right. Well, we will still get through with him, still working modalities to ensuring that we can, put it all out there. But there are some concerns that we must indeed begin to look at. Nigerians are having very salient concerns. One of such would be the fact that many Nigerians lack access to affordable healthcare services due to low enrollment and rates and non-compliance. Doctor, are you there? Hello, doctor? Okay. Well, we would have to reconnect with you, doctor, and indeed get along with the discourse, right? We're still talking, matters that border around Nigeria's health sector, the challenges and the expectations. And yeah, we were trying to look at some of the concerns. So the question that might arise from the place where Nigerians lack access to affordable healthcare would be, how can the government ensure universal access to healthcare services? Right now, this concern is one that that cannot be thrown under the rug. It cannot be, it cannot be overlooked because of how serious it is. How can the government ensure universal access to healthcare services? Because the implication would mean inequitable access can lead to poor health, outcomes and increased mortality rate. And the expectations that Nigerians are having would be the fact that, hey, Nigerians expect the government to enforce compliance, right? Nigerians really expect the government to enforce and pour in another one right there, right? And what would be the expectations of Nigerians? Or rather, before the expectations, what questions can we now, devolve from all of this? How can the government ensure sufficient funding and improve healthcare infrastructure? Hello, doctor, are you there? Hello, doctor, are you there? Can you hear me? Hello? Okay. All right, doctor. We'll find other means to connect with you at this point in time, since this is almost seeming as though it's having a little bit of a hitch, right? And we will look at, also the lack of transparency and accountability is very important to, look at that, because limited transparency and accountability can hinder the effectiveness of the policies. And one question that would ring a bell would be the place of how can government ensure transparency and accountability in policy implementation, right? And the implication that would mean lack of transparency can lead to corruption and mismanagement. And that's what Nigerians have as a concern. Because, if there's no transparency, then we may not just be going anywhere with this. It might just begin to seem as though we are on a wild goose chase. But then there are other concerns. One of such would be the fact that as some Nigerians are saying that, look, how can the federal government indeed beat her chest and say that they are doing the right thing by trying to see how Nigerian doctors outside the shores of Nigeria, would indeed come back to the country just to show some service, render services and all of that, and also try to see how the doctors here would not also have to leave our country, because over time we've seen tremendous exodus of some of our best intellectuals leave the shores of Nigeria for greener pastures. Isn't it natural for every human being to want to say that, hey, if I see that the grass on the other side is indeed greener and there are more opportunities for me, wouldn't I want to, explore, in that regard? We've seen top official, including even our president, right? And past presidents, by president, I'm not just talking about President Bola Tinubu. I'm saying from the past president, even Jonathan, the Buharis, the Obasanjos, and the rest. They leave the shores of this country to go outside the shores of Nigeria, and for treatments that's supposedly we cannot offer. But then there are some policy that is coming to mainstream, that is trying to also say that, hey, you doctors of Nigerian descent, come back home. We want you to come back home and practice your trade or apply your trade here. And then some policy is also trying to see that there is some sort of restrainment or constrainment of doctors within the shores to even want to step outside the shores of Nigeria. Now, the angle would be, would that not be a double standard? Yeah. Wouldn't that be a double standard, is what Nigerians are saying, if you're beginning to look into it from the way that you are wanting to go about it? Government, do you think that you are really being sustainable, showing sustainability, transparency? Are you being realistic at this point in time? Well then, we'll just take a little breather and we'll be right back in a short bit. Remember, this is Eagles Outlook right here on Eagles 102.3 FM Abuja. We give you an audiovisual radio experience that you can count on anytime, anyway.
Sorry for the inconvenience.
I suppose it was inevitable. Eagles 102.3.
To go. Oh yeah. Let's save Nigeria, so Nigeria won't die. Which way Nigeria? Which way? Which way Nigeria? Tell me which way to go. I love my fatherland. Oh yeah, I want to know. Yes, I want to know which way Nigeria is heading to. Every little thing that goes wrong, we start to blame the government. We know everything that goes wrong because we are part of the government. Let's save Nigeria, so Nigeria won't die. Which way Nigeria? Which way Nigeria? Tell me which way to go. Which way to go? I love my fatherland. Oh yeah, I want to know. Want to know which way Nigeria is heading to. Inefficiency and indiscipline is ruining the country now. Corruption here, there, and everywhere. Inflation is soaring high. Let's save Nigeria, so Nigeria won't die. Which way Nigeria? Which way Nigeria? Which way to go? Which way to go?
Right, which way Nigeria, which way to go? I love my fatherland. And yes, this is the reason we're still having this conversation right here on Eagles 102.3 FM Abuja. Yes, my name is Uduak Daniel, and we're still right here to speak with you on matters that concern Nigeria's health sector and, of course, the challenges and expectations. Well, I've got my guest, Dr. Ubongesien, former Vice President, Association of Resident Doctors, National Hospital Branch, on phone, and to have this conversation. Welcome aboard once again, Doctor.
Thank you very much, Udrak Akwan Daniel.
Yes,
it's
please.
A pleasure. And,
That's right.
Good morning, Abuja.
Right. Well, I know time is fast spent, though, but I would like you to give us just a peek into some of these, the policy, the National Health Insurance Act. Let's start with that one, and then, of course, we will jump into the national policy on health workforce migration.
Okay. First of all, I want to commend the government of President Muhammad Buhari, who was the one that first signed in the act 2 years ago.
Right.
And the act was one of the brilliant ideas of President Obasanjo in 1999, and the aim of midwiving this act was in order to ensure that there's universal coverage of healthcare, and not just universal coverage of healthcare, but universal coverage of affordable, accessible, and effective healthcare to all Nigerians of all cadres, of all tribes, of all religion. As it is today, the National Insurance Healthcare, it's more effective, or it's better effective with public officers. What I mean by public officers are individuals who have jobs with government institutions.
Okay.
There is also a package that has been created for those in the private sector, not as robust as what we have in the regular government sector. And the aim of the National Insurance Health Act was to ensure that every individual is able to access basic health care in compared to what we have in developed nations like the United Kingdom, NHS,
right,
where almost the entire citizenry are captured under the Health Insurance Act. And the aim of that was to ensure that individual citizens of those countries are able to access healthcare at affordable prices.
Right.
In fact, if you compare individuals accessing healthcare out of pocket vis-a-vis those accessing healthcare from the insurance health scheme, you would realize that the amount of money you pay out of pocket is almost 4 or 5 times the amount you would have paid if you were under the Insurance Act. So it is able to give you accessible health at a cheaper price, and afford not just only at a cheaper price, but an effective healthcare. And that is the brainchild of what the government of Nigeria is trying to do in order to ensure that the market woman in the village. The young boy, in the village, the middle-aged man who works, in the town, in the urban centers, is able to access similar quality of healthcare, irrespective of where he lives, irrespective of where he domiciles, and is able to access care at an affordable price. Nobody budgets for healthcare. If you look at, by the time you're paid your monthly stipends, your monthly salary, nobody says, I'm going to set aside 10,000, 20,000, 50,000 for healthcare. So the importance of the insurance is that at any time where you fall ill, you are able to access healthcare immediately.
Yeah, but
I don't know if you understand
yeah,
what I'm trying
but
to
as
explain.
accessibility to the NHIS, the scheme in itself now, has it been a realism? Has it been a reality so far?
In all honesty, it's work in progress. Where we started from, we've made some tremendous progress. Like I had mentioned earlier, initially it was almost exclusively found within individuals who are working for government establishments.
Right.
But as I said, some reformation had taken place, some development had taken place. Now we have partners in the private sector. We now have partners in the banking sectors and other non-governmental organizations. So people are keen in every day. The only problem we've had, in all honesty, I think it has to be with funding.
Right.
Because if you look at the scope with which the NHIS covers, as inflation tends to increase, a lot of some essential drugs, some essential services appear to have been removed from the list of what individuals are able to access. And this has to do with funding. But in terms of having people from the private sector, in terms of increasing coverage of who can access insurance healthcare, it has made significant progress in that regards.
Right. Well, let's. That being said, would you also say that in terms of, will I call it? How do I put this now? In terms of reaching out to people, how much awareness? That's the word. How much awareness do you think Nigerians have about the NHIS so far?
Okay, I think to a large extent, awareness will also depend on the social demographic nature of the locality in terms of educational advancement of a particular region. Within the city centers, the towns, to a large extent, in terms of awareness, a lot of people are aware that NHIS exists. However, among the local populace and areas with lower educational access, the awareness about NHIS is still far below average.
Okay.
But as I said, for those within the urban centers, those that are educated, middle class, upper class, the awareness the coverage is very good.
All right, so I'll put some back to your thoughts.
But more needs to be done.
Yeah.
More needs to be done in the villages and those in the lower cadre in terms of providing better awareness that this scheme exists and that you can access health at a cheaper price, at an affordable price, and not just an affordable price, but equal in terms of quality, same quality of health, even when you live in the village, even when you live, in the local government. So, traditional leaders, religious leaders needs to also help. Government needs to also partner with these individuals to ensure that they're able to trickle down this awareness, not just in the city centers, but trickling down to the old woman in the village, trickling down to the farmer in the fisherman that is in the riverine area, so that they would know that yes, this scheme exists and you can access healthcare at an affordable price.
All right, so I'll put it back to your thoughts now. We've got to pay some bills. We'll be right back in a jiffy, though, right? This is Eagles 102.3 FM, Abuja. Let's go pay some bills. We'll be right back.
Eagles 102.3 Abuja.
Attention, educators and leaders. Enhance your professional development and leadership skills today at the 2024 IELPN International Conference. The Institute of Educational Leadership Practitioners of Nigeria presents the IELPN International Conference and call for papers. Theme: Revolutionizing Education, Harnessing Innovative Pedagogies and Leadership for the 21st Century Students. Date: August 14th and 15th, 2024 at the National Universities Commission Auditorium, Maitama District, Abuja, FCT. Time: 10 a.m. daily. Conference registration fees: students 15,000 naira, members 30,000 naira, non-members 40,000 naira, corporate members 150,000 naira. Virtual participation just 15,000 naira. Join us for an inspiring event with keynote speeches, interactive workshops, roundtable discussions, and gain cutting-edge insights from top educational leaders. Special guest, Professor Paulinos Chijoke Okweli, Executive Secretary of the National Commission for Colleges of Education. For more information and registration, visit www.ielpn.org.ng. Email ielpnmembership@gmail.com. Contact us at 080-2222-5781 or 080-6630-6872. Don't miss out on this transformative experience. Network with peers and leaders in this education sector.
Eagles 102.3 Abuja.
Welcome to Feminism Friday, where every Friday is a celebration of gender equality and empowerment. Tune in to Eagles FM 102.3 from 11 a.m. to 12 noon on Friday for inspiring talks on gender roles, women's rights, and inclusivity. Join us for inspiring conversations, insightful discussions, and the best part is that you get to contribute and be part of the program. The show will spotlight the champions of feminism and offering actionable steps for a just and equitable Nigeria. Feminism Lab, where your voice makes a difference. Take action with us now. The program is a production of Feminism Lab, sponsored by Friedrich Ebert Stiftung, Nigeria.
Eagles 102.3 Abuja.
My people, the thing where they happen for my area, eh?
Do you think I will now find out that you have contract to bring fresh girls?
I brought you from the gutters. Who gave you all the connects? MDG who? Without me, you would have been nobody. But
Join Media Coalition and Awareness to Halt Human Trafficking, MICAT, on I Wish I Knew radio drama every Saturday at 10 a.m. Let us join hands and kick human trafficking out of our communities. I Wish I Knew radio drama, brought to you by MICAT in partnership with the National Agency for Prohibition of Trafficking in Persons, NAPTIP, and funded by the Embassy of Denmark in Nigeria.
Sorry for the inconvenience.
I suppose it was inevitable. Eagles 102.3.
35 minutes gone past the hour of 9 on the AM side. It's the Eagles Outlook right here, and we're still looking at the topical issue that borders on Nigeria's health sector. And looking at how we can improve on it, as well as the challenges that we face, in that sector. And with me would be Dr. Ubong Isien, who is the former Vice President, Association of Resident Doctors, National Hospital Branch. And we've been talking this conversation. You want to join in the discourse, you can get across to the number 0907 353 0044, or you call 090-8766-8888. And the WhatsApp portal number, just send a WhatsApp portal message to text message, or precisely a WhatsApp message would be 0909-705-4450. Doctor, are you there?
Yes.
Yes.
Very well.
Let's look at the second story. I mean, the national policy on health workforce migration. I mean, this policy is aimed to reverse the brain drain in Nigeria's health sector by encouraging Nigerian health, care professionals abroad to return. And the policy is facing challenges, though, which includes poor working conditions, inadequate funding, limited awareness, And there has been some position that the stakeholders have held. The stakeholders, including the government and healthcare professionals, have expressed concerns and expectations. What would be your salient thoughts with regards, this policy? Because I stand to be corrected, though. If I think one of the ideas about this policy, as we found on the front pages of Nigerian newspapers, will be the fact that Nigeria is trying as much as it can to meet up with the demands for healthcare, professionals who are supposed to be in Nigeria, to be resident here, to ply their trade here in the country. But then there is some sort of aberration in terms of the fact that we've had more of our healthcare professionals outside the shores of Nigeria practicing their trade, and about 1,400, or so have been identified so far, and there are talks to get them back to return home to practice on this soil. But then there's also been some thoughts about regarding how to not allow or somewhat constrain health professionals here in Nigeria from even traveling out. And Nigerians are asking just one question, and the question would be the fact that how could it be, or wouldn't it be a matter of double standard to have, the government of Nigeria that has its elite and politicians leaving the shores of Nigeria whenever they have a cause to attend to their healthcare needs, and not staying back here to use the facility that we have, but rather there is now some talk about seeing to it that we brought the Nigerians outside the shores of Nigeria who probably left here, seeing a greener pastures, to other parts of the world, or constraining those who are even here to seek such opportunities. What would be? How do you put all of this together?
Okay, I'll start by saying that medical drain migration isn't new anywhere in the world.
Right.
In fact, the UK currently faces similar crisis, where most of its health workers are migrating to better climate, migrating to the US, to Canada and Australia, because they found out that they have better pay, better services, better welfare packages than its own healthcare system. So everywhere in the world has always experienced one form of migration in terms of healthcare at one point or the other. So Nigeria is not new. It is natural that everyone would want to go to where it's greener, where it's better. So it's not new. But what hits us in the face is that for Nigeria, that is a developing nation, we truly need these manpowers to be domiciled here to treat us. The reasons are because we have higher amount of infectious diseases as compared to other developed nations, and then we are still struggling in terms of equipment and facilities. So losing on equipment and then losing on skilled manpower is double tragedy. At the moment, the WHO has stated that the doctor-patient relationship should be 1:500. In some parts of the country, the doctor relationship is some 1 to 10,000, 1 to 100, or to 20,000 naira. And what that means is that the kind of care that doctor will be able to offer to that large number of patients would be definitely ineffective. But when you have a sizable number of patients, few number of patients where you're able to attend to at a time, your proficiencies are better. The aim of this new law is to see how we can improve the retention rate of medical personnel. What I stated earlier regarding the doctor-patient relationship is just for medical doctors. We have not talked about other members of the team, the nurses, the lab scientists, the radiographers, that are important key team players in order to ensure that healthcare delivery is optimal. We are also losing those other healthcare workers even more than medical doctors. where
Hello, doctor. Are you there?
in our healthcare
Okay.
are best brains.
So
The questions they are obviously glaring.
yeah. Well,
Where remunerations are not at par with what you have in other countries, in other developed nations, you're definitely going to have brain drain. People are going to be moving to those areas in order to afford similar type of remunerations. Beyond just remunerations, welfare packages, facilities where you work and you're not able to get adequate job satisfaction. You know what you have offered this patient is suboptimal, and it is not because you do not have the skills of offering the optimal services, but because of the systemic problems of issues with facilities, you're not able to offer. So you prefer to work in an environment where you're able to provide optimal services vis-a-vis the available facilities available to you. So
Right.
these are some germane issues that I think government should look at. If today your remunerations become at par with your colleagues anywhere in the world, you won't have reasons to go. Don't forget, traveling out is not as easy as we think. It comes with a huge financial burden. It's capitalist intensive, and then traveling over to other countries, you're not just going to enter into the systems, as we think. You have several hurdles you have to go through before you can finally go into the system and practice very well. So if you have all you need, your welfare packages, your remunerations are better, your facilities are better, I'm sure most Nigerian healthcare workers, I'm not talking about healthcare workers, including doctors, nurses, and all the other affiliates, would want to stay back and practice.
So
in some countries,
yeah.
those who reside in the rural areas are given additional stipends, knowing quite well that the rural setting comes with its own challenge. You're not in tune with what happens in town. You don't have similar facilities like someone who lives in the urban centers. And so in order to retain health workers in the rural areas, I know the Kingdom of Saudi Arabia does that. They give you some higher additional incentive, some higher package, and the aim is to keep you in the rural area so that you can offer adequate services to those within the grassroots.
Right.
Similar thing can be replicated in Nigeria. If we have some of these systems working, I'm very sure the number. I know what happened in 1992 when President IBB, was the head of state. He was the one that was able to increase some of the scheme of service for health workers, and that was able to reverse some level of brain drain. In fact, as we speak, in the United Kingdom, there is an increased advocacy for children in primary and secondary schools, colleges, to look towards studying medicine in the university. Why? Because they realize that everybody has left medicine, everybody wants to be doing technology, IT, artificial intelligence, and they are losing every day in terms of the number of healthcare professionals. And so at the moment, there's an increased advocacy that teachers, increase in employment of science-based teachers, increase in advising children as they grow up, that if you want to, we would prefer you to think towards a science-based, profession, preferably the medical profession. And the aim is to see how they can increase the number of output of medical personnel in their society in order to be able to measure up the patient-doctor, the health worker-patient relationship, to be able to reduce the burden on the healthcare system.
Well, anyways,
this is something that.
Yeah, well spoken. But let's just see how our family members can be a part of the conversation at this point in time. As I've got also a question to ask, but I'll just let the listener do their bid in this from this time. 0907-353-0044 is that number to call. The other number would be 090 8766 8888, and the WhatsApp portal number would be 0909 705 4450. I've got a couple of messages via the WhatsApp portal now. This one says, from Samuel, all the way from Kuje, says, greetings to you, my brother Udwak Daniel. Greetings. Health is wealth. Permit me to say that a healthy nation is a wealthy nation. Then way and manner the people in authority handling the health sector in this country is not friendly at all. If the government will have money to buy jets, renovate VP's house, buy SUV cars for legislatures, why can't they have money to put our hospitals in good shape, take proper care of the medical personnel, make the environment conducive for both the patient and the doctors and nurses to operate? If they do, our medical personnel our medical personnel that are outside the country will surely come back to the country. May God make it easy for us in the country. In the name of Jesus Christ, says, amen. Have a fulfilled weekend, UD. Thank you, Samuel. And to this one here, this one says, on NHIS, right, there is a low coverage because of lack of awareness. Those who are enrolled always complain of low quality services and drugs administration compared to patients that pay directly for services. HMOs have also been fingered for mismanaging funds allocated to them under the scheme for health management. These challenges can be tackled by scrapping HMOs in Nigeria. Have a nice day, UD. Yusuf from Museitu is saying that. Well, how do you respond to this?
Well, the second speaker was about saying my mind to a large extent. Yes, I know there's a cap. The NHIS gives various hospitals cap in terms of coverage of the kind of medications, the kind of services that can be offered. If you go above that cap, you would have to lose some money. I'll give you an example. Assuming paracetamol costs, say 100 naira, NHIS will tell you, okay, for people that will be able to access this paracetamol, only supply paracetamol not more than 20 naira. So that means any paracetamol that you have within your pharmacy that is more than 20 naira, people that are covered under NHIS should not benefit from it. Okay. So they give you a ceiling. And the reason why they give that ceiling is, I think it has to do with the available funds on the part of government. I don't know if you understand.
Yes.
So at the point, a lot of people at the end get to lose accessing these drugs and these services because, as we all know, inflation is already a double-digit inflation. The cost of drugs have gone up. The cost of services have all gone up. So most of the prices that NHIS had given earlier on, the cap they had given earlier on, have, because of the current inflation, people can't access them anymore. And that is the honest reality on ground.
Well,
so what government needs to do, I think, is to provide more funds, because if you have more funds, we are all living witnesses of how the cost of commodities are, drugs inclusive. Pharmaceutical companies that used to produce drugs in Nigeria, a lot of them have left because of the economic, realities. And so the natural thing is that you're now importing drugs. So you're going to add all the costs, the middleman cost of transport and all that. So cost of medications, cost of services have actually gone up. And some of the prices NHIS had given as caps for those medications, for those services, are no more sustainable. And so a lot of individuals have lost the coverages,
So the question would now be, have we been able to indeed prioritize the healthcare, sector in Nigeria? Have we been able to do that?
Well, I think on the papers, yes, to a lot on the papers, yes, we have. In reality, I'm not sure, but well, it's a step in it. We don't have it's the government has to keep working every day. Rome was not built in a day. I'm very sure subsequent governments and even the current government is doing its best to do the best they can. I know much more can be done. I'm also trying not to be political. I just want to be as professional as I can in my utterances. So government can still do more. I'm sure government is trying its best, and that is one of the reasons why this new act, on reversing brain drain was implemented in the first place.
Right. Do you think there's been a lack of transparency and accountability in the entire processes, especially in the systems that establish clear reporting mechanisms, conducting regular audits, and maybe punishing corrupt, practices within the health sector?
Well, I would say that corruption is everywhere, not just in the health sector, but more can still be done. And I'm sure if culprits are brought to book, transparency would improve. Just like the last person who asked the question on the role of HMO.
Yeah.
I'm sure if government is able to come out brutal, against those corrupt HMOs, things would improve. Unfortunately, corruption even stems down to even the security man at the gate. Is that bad? So, but sometimes it's a reflection of who we are. It's a reflection of our leadership. It's a reflection of who we are as individuals. So I think government needs to be more proactive, needs to be firmer, do the needful, and our healthcare system will be better.
So what were your final thoughts, to the government, to the people, as well as to your colleagues in the profession, especially in a time like this when we are at risk of even not just the policies now, not just the NHIA or NHIS, act now or the scheme, but of course the recent MPOX that's going on, where Bayelsa is indeed topping the charts in this regard. What will be your final thoughts, basically, though? In that regard?
Let me start with my colleagues. I want to truly appreciate my colleagues who have stayed back. In fact, it's not easy to stay back. When you look at the kind of the workload you do, and then you look at the services you're offering vis-a-vis the available resources, vis-a-vis the available facility, indeed, it's a great honor. It's a great patriotic act to stay back and serve the country. We are grateful, and I truly appreciate those that have stayed back.
Right.
And with regards to the MPOX, my colleagues, to encourage them to be vigilant and take government rules and regulations and guidelines, seriously on how to prevent the spread of these MPOX.
Yeah.
And then to government, we appreciate the fact that there have been some positive steps towards improving, on paper, preventing migration of health workers. We know this can be done if the government is able to come in practically, finance the health sector, provide better facility, make better working conditions for both doctors whose practice both at the local government, at the state level, and at the federal level. Provide equitable and better welfare packages. In fact, we will have a lot of doctors stay back and even come back. But it has to come out in practical terms. You could see the amount of money governments are investing in other countries. We, at the moment, the health sector gets about 4.5%. That was their budget declaration, to domicile 4.5% of the national budget on health. I'm not sure we are getting up to that.
All right, so thank you.
From the annual budget, getting 4.5 is below what we are getting. If we are able to at least do that, we should see some positive things, in the health sector.
Okay.
Those are my thoughts.
Thank you far too kind, Dr. Ubong Essien, for joining this conversation this morning. You're the former Vice President, Association of Resident Doctors, National Hospital Branch. We're looking forward to having more conversation with you in the coming future, right? In the near future, rather. Thank you, Fatih.
It's my pleasure.
Sure.
It's my pleasure.
This is where we call it a close. The conversation has been around Nigeria's health sector challenges and expectations, especially looking at the two policies that has been out there. One of such would have been the policy that borders around the National Health Insurance Act, and also this national policy on health workforce migration, right? These are very, very serious policies out there. But it is also very necessary to say that the National Health Insurance Act and the National Policy on Health Workforce Migration they both have the potential to improve access to some affordable quality healthcare services, for all Nigerians. However, the issue has always been, the bane of it all has always been implementation. It has always been funding, implementation, funding, and awareness, because these are limited. And how do you reach out to the poor, in our society, especially considering the poor health infrastructure that, precedes our activities, especially in governance and even in that sector. To address these challenges, government needs to indeed enforce, compliance, increase some awareness, and maybe allow for to provide adequate, funding, operationalize the Vulnerable Group Fund, because by so doing, can the government, ensure the policies achieve their goals and improve, the healthcare delivery in Nigeria. But then this is the size of it all. I want to say thank you to each and every one of us that partook in the discourse this morning. Thank you, far too kind. And I want to wish you a lovely, lovely, happy weekend. Next week is yet another time to engage in a discourse. My name is Udwak Daniel.
Eagles 102.3 Abuja.
This is Eagles 102.3 News, your number one radio experience.